Welcome everyone to this month's Empath Health Veterans Briefing. If you are joining us, we'd appreciate it in the chat if you could share, if you're with a veteran service organization, the name of your organization. And if you're comfortable, you're a military veteran, please share your branch and area of service. We'll get started in just a few minutes. Welcome, everyone. We're going to get started in just a few minutes. If you're just joining us, would appreciate it if in the chat feature, you could just share your name. And if you're with a veteran service organization, if you could share the name of your organization. And if you're a military veteran and are comfortable, just share your branch and area of service. Welcome, everyone, to this month's Empath Health Veterans Briefing. We're going to get started in just a minute. If you're just joining us, we'd appreciate it if you could share your name in the chat feature, along with, if you're with a veteran service organization, the name of your organization. And if you're a military veteran and are comfortable, please share your branch and area of service. Welcome, everyone, to this month's Empath Health Veterans Briefing. We're going to go ahead and get started. I'm going to turn it over to Trudy Beeler now.
Hi, everyone. Thank you for joining us today. And thank you to our wonderful team of panelists joining us from 211 Tampa Bay Cares and the VA healthcare system here at Bay Pines. This is a really important topic to me. I often see inquiries coming from members of the community about meeting a veteran who's struggling with homelessness or accessibility to food and certain resources. So I think today's informational session is going to point you in the direction of when you meet a veteran that's struggling, as to who to best direct them to, so that we can connect them to the resources and support available in the community as well as in the VA healthcare system. So without further ado, we've got a lot of information to get through. I want to introduce you to Wade Roberts with 211 Tampa Bay Cares, and he's going to share us information about the Florida Veterans Support Line and 211. So welcome, Wade.
Thank you. My name is Wade Roberts. I am with the Florida Veterans Support Line at 211 in Pinellas, and today we're going to go over a little bit about what we do with the Florida Veterans Support Line here. All right, next slide. All right, for our agenda today, we're going to go over what our peer support services do, what we do as the veteran care coordinators, who do we assist, why veterans call in, how we assist those veterans, and then how does a veteran contact us, and then one of our success stories. So originally, 8 years ago, when this program kicked off with the Crisis Center in Tampa Bay, this program was answered by our call center reps who were non-veterans. And throughout the years, the first couple of years of the program, we found out that some of the veterans that were calling in really didn't want to speak to someone unless they were a veteran and shared that lived experience and knew the lingo that veterans speak. So we decided to make it a peer support service where those veterans were able to call in no matter what time it was, 24 hours, 7 days a week, and speak to another veteran based on their needs. All right, so what do? We service veterans in Pinellas, Pasco, Hernando, and Citrus counties. So a lot of times you will see us at different events throughout the different counties that we service. We provide emotional support, care coordination of veterans, which can be up to 90 days of care coordination. Generally, even if they go past the 90 days, which generally doesn't happen, we're still there to help guide the veteran, whatever they may need in the community. And the program is set up to essentially assist the veteran into becoming taking on the head of their situation. We kind of just guide them to where they want to go and give them the information and kind of help push them along so they can tackle that whatever barriers they may have in the community. All right, next slide. All right, so back one. All right, there we go. All right, so why do veterans call us? So 9 times out of 10, through my experience of being here 4 years, is generally housing or some type of financial assistance, whether it be rent, shelter, utility, and move-in costs is pretty much our number one financial assistance service that veterans need. Lately, we've been getting veterans especially in Pinellas, that have landlords who are charging 3 times the rent, and the prices are going just skyrocketing to the point where they just can't afford it anymore, or to move into Pinellas or do anything. So what we are here to do is kind of bridge that gap where veterans are able to move in and get the assistance they need to even get into the place, because a lot of our veterans are on fixed incomes and they just can't afford those types of payments. And then also we have our crisis intervention services, whether it be our suicide team here, we have our crisis intervention team, substance abuses, mental health challenges, whatever the veteran may need when they call in. We have services for that. We're all trained in assisting the veterans, and then also connecting the veteran to related services, whether it be somewhere like Empath Health, or they need to get connected to the VA, or any services that they may need. Next slide, please.
Having a little issue. There we go.
Okay. So how do we assist? So with With our community partners, the VA, and then also the SSVF hotline, we have the luxury of answering the SSVF hotline, which our calls come from all over the state of Florida. So we are seeing a lot of uptick with a lot of the movement that's coming in from all over the US. So we have a lot of people coming into the state of Florida, a lot of veterans who are homeless, needing assistance with getting in. And I know there's been quite a pause on SSVF referrals, and we're working that out as we go. Just know that we are assisting you, and we're doing the best that we can. We are getting a lot of veterans that need the housing, but with the housing market the way it is right now, you know, with being very minimal houses for veterans or people in general, we are working out the kinks of that. And then also, we also work with the veteran service offices, the local vet centers. We have our local shelters that we work with, and then the mental health providers as well. And then I also want to let you guys know that Duke Energy is donating $160,000 to 211, and it is only for utilities. So it'll be water, electric, and gas, which that should be coming out today, that announcement. So if you guys have any veterans that are needing assistance with that, we have that set aside, a special portion of that where we can help our veterans and do what we need to do to help them get into places, or with everything that's going on between the hurricane and things like that and FEMA, that we can help those veterans. All right, next slide, please.
A little bit of delay here. Hang on.
Oh, it's okay, no problem.
There we are.
All right, so whenever a veteran calls in, they can reach us by dialing the 1-844 My Florida Vet number, or they can text in to us directly, which is the 898-211 number. So whenever they text in, a lot of times our hold times may be a little long. You know, with 211, we're getting a lot of calls in. We're getting a lot of veterans who need help, or people just in general that need help. And the easiest way for them to get to us is to text in or call that line, which the text line is a little faster, to be honest with you, than getting the calls in, because we're answering so many veterans calling in that need assistance. So I want to push that out there for the veterans that need the assistance. And then also, we are a little short staffed right now on the veteran side of it, but we are taking care of that. With it, we should have another care coordinator in about 2 weeks, and then also another database resource coordinator. So if you guys need anything, just feel free to call me, call this line as far as veterans, and then also texting in. We'd be happy to assist you, and I want to thank you guys for having me today. And then here is one of our success stories that we just recently had. I want to read this to you. The veteran peer support line received a call from a case manager with the GPD program at St. Vincent de Paul. The case manager had an elderly veteran needing assistance with moving costs and helping with his belongings. Paying for these expenses was impossible for the veteran with his fixed income from Social Security. The Florida Veteran Support Line in Pinellas was able to work with an internal financial assistance program and get the veteran's moving costs paid for. We were also able to help the veteran find services that assisted him with moving all of his belongings. If not for the connection with the Florida Veteran Support Line specialist at 211 Tampa Bay Cares, this veteran would have had a much more difficult time finding services to move into his new residence. So with our financial assistance services, which we have specifically for Pinellas, we do have a United Way fund that we try to use specifically more for our veterans, that can assist with just not the norm of having rent and utilities. So sometimes we may help with moving costs, or sometimes fixing a car, or some type of repair with the home of a veteran if they need that. It really just depends. So we're more flexible with that fund, the United Way fund. So if you guys have anything that's kind of the one-off where it's not just the rent and utilities, feel free to call me about that as well, and then we can see what we can work out as well. So again, I want to thank you guys for having me. And if you have any questions, feel free to call me.
Great. Thank you so much, Wade, for sharing that information. We're going to hold questions. If you do have questions, do feel free to type them into the Q&A or the chat at the bottom of the screen. But we'll hold those until the end just so we can get through the content from all of our presenters today. So yeah, 211 is a great first step for anybody in the community. And then with this dedicated Florida Veterans Support Line, it streamlines the process for our veterans. So thank you for the information today, Wade.
No problem.
Thanks. I'd like to jump over to our next presenter, who is Blossom Capper with VA Bay Pines homeless program. So Blossom, if you'd like to go ahead and unmute and introduce yourself and tell us more about this important program at Bay Pines VA.
Thanks, Trudy. Hi, yes, I'm Blossom Capper, and I'm the homeless program coordinator at Bay Pines. I've been with Bay Pines for a little over 10 years in the homeless programs the entire time. We have a lot of great services to offer, and I'm excited you guys are all here to be able to learn more about what we do and helping our veterans. Next slide. So I always first like to talk about our outreach services. Outreach services are really the front line. We hope that our outreach team is out there, often meeting the veteran first, or the link between you all and the community and back to the VA to help our veterans. We have 4 clinical social workers assigned to Bay Pines VA. We're a little more densely populated in Pinellas than our southern catchment area. We cover all the way down to Collier County. So we have 3 of them stationed up here near Bay Pines. And then we have 1 social worker down in Lee County who covers Charlotte, Lee, Collier, and even over into the Sebring area. Regarding Pinellas, because I know that's where most of you are from, I was able to get my hands on some data this morning. And as of October 18th, there were 261 active homeless veterans in Pinellas County. And that's managed by our Homeless Leadership Alliance. That's how I was able to find that number. That doesn't mean there's 261 street homeless. They might be in some of the programs that I'm about to talk about. Our outreach workers wear a few different hats. They serve as liaisons with our community programs, which I will talk about in future slides. They do outreach, and they do a great job at maintaining community partnerships. We really could not do what we do without our community partners. Wade's a great partner. SSVF's a huge partner to us. So our outreach workers really help us maintain that. We do outreach at places like Safe Harbor. We station ourselves there once a week just to make sure if there's veterans at Safe Harbor, we can try to also pull them into VA homeless services. We go to Daystar. I'm sure most of you are familiar with Daystar once a week on their outreach day and try to engage new veterans. And then we have outreach events. Some of you might be familiar. Probably our largest outreach event is called the Homeless Stand Down. In 2022, we had 283 veterans in attendance at that event. And that was despite we had really bad weather that day. We were rolling out of the pandemic and we still had a good turnout. At that event, and then outside of that event, something I want to speak on, we have our stand down court. What the stand down court is, and it's held annually at this stand down event, is where a Pinellas County judge comes. He hears veterans' cases, often they're old cases. They're fines that have been sitting around since the 90s that have been a barrier to getting the veterans a job, to find a landlord because they have these old felonies or maybe an outstanding warrant. And often this judge can waive fines and let them start fresh and move forward. We also have, we don't make them wait that year. We have what's called veteran justice outreach workers that fall under our outreach, and they're a liaison between the court system and the VA, and they have specific veteran court. So if there's a veteran involved legally, we let our veteran justice outreach social workers know, and they can get them in veterans court, which is good because veterans court's aware that, hey, we have our own internal resources. We have the substance abuse treatment center, we have mental health, and we can link them if that's a part of their court treatment plan. As far as the stand down court in 2022, the judge waived over $353,000 in fines. So it's really amazing what they come out and do for us. Next slide. So homeless is a large umbrella. We have short-term emergency shelters, which is the snapshot that you see on your screen. And then we have grant and per diems, which I'll go into. And then we have permanent supported housing, which is served through our HUD-VASH program. So these are the contract shelters. We have 96 shelter beds in Pinellas and down to Charlotte, but about 70 up here in Pinellas. Next slide, please. These next few slides will go through specifically what each shelter provides. And I'll tell you, they're all very similar. Most are 30-day shelters. St. Vincent de Paul is a 30-day shelter. There's really, except one program that's unique. There's really no income limits in our programs. There's no charge for the veteran to participate. We try to maintain an open door. There's walk-in hours, and we also take internal referrals. You see that last bullet that says low demand model of care. Like I said, we have that strong community partnership, and we've worked really hard with our community partners to say, let's give veteran chances. I always like the saying, we can have, set high expectations for them, but put low demands on them, meaning we want them to be sober. We want them to get treatment, but if they're not quite there yet, that's okay. Let's wrap the housing around them, and then often the rest falls into place. So St. Vincent de Paul in particular does a really good job at meeting that low demand model, giving veterans chances, even if they're relapsing, to stay in that shelter bed until we can find them permanent housing. Next slide. Another one of our contracts is in Bradenton at the Salvation Army. I won't go too into that since it's outside of Pinellas. It's a smaller contract, 10 beds. But very similar, no income limit, no charge to the veteran. All of our shelters provide meals, furnishings, toiletries. Next slide, please. Charlotte, another one of our south of the bridge, very busy shelter. It's kind of our only one down that far south, so it pulls people from all over. Next slide, please. This program's unique. This is located at HEP, Homeless Empowerment Project. You must have a mental health diagnosis to go to this program. They house 24 of our veterans. They get a little longer length of stay there. They can stay for 90 days versus the 30-day shelter stay. And that is because they have that mental health diagnosis and they need a little more wraparound. Next slide, please. This is our most unique shelter. This is also in Pinellas, located in Seminole, Florida. It's run through Boley, Morningside. They must have a mental health diagnosis and they must be chronically homeless to be in this program. So it's a unique referral criteria, but it definitely touches our most hardest to reach veterans, the ones that have been on the streets for years, that maybe are even ambivalent about leaving the streets. Sometimes they get out there and that's more comfortable for them. So they give them their own room. They're definitely the model facility of that low demand approach. It's a wet program. They don't allow substances on site, but if they come in intoxicated, they do have their own room to go to, and the hope is they don't disrupt the rest of the community. Next slide. So all of the programs I just discussed are what we call contract programs. They're run by the community. We have a contract with them, and the VA helps them oversee it. We have inspections. We make sure the food is on point. We make sure the facility is safe and sound. We make sure the case management's going well. We do chart reviews. But this particular program, the Domiciliary Residential Rehabilitation Program, you'll often hear it referred to as the DOM, is located right here at Bay Pines, and it's a back to work program. Veterans who can go back to work but need that extra push, need some retraining, some help with interview skills, and are homeless, can go here, be housed here while they work to get back on their feet and get back to work. Next slide. These are our points of contact. So like I said, each outreach worker is assigned a program. I'm the supervisor of the programs. probably best if you guys ever needed anything, just come to me and then I could decide, you know, which I thought was a good fit for, and I'd probably link you on to another liaison, but definitely use my name and my cell phone number, that 430 number, as a starting point. Next slide, please. So the other piece of our umbrella, we just talked about the short-term emergency housing. The second piece is grant and per diem. They often start in shelter. And if we find, you know, they need a little bit more support, they're not going to resolve in 30 days. They need a little more wraparound. They go into our grant and per diem programs. This is more transitional housing. They get 3 to 6 months in these programs. Each grant has a different, what we call, model of care. So for example, Homeless Empowerment Project has what's called clinical treatment. So we'll funnel our veterans there who have the mental health diagnosis. HEP is, like VA, is very resource rich. They have their own mental health counselors there on site. So we find that's a good program to put veterans with mental health or other clinical needs. St. Vincent de Paul has what's called a low demand grant. So those are the veterans who, again, chronically homeless, in and out of homelessness, and really need that support of a program that's going to work with them through those struggles. And another couple of unique grants, we have hospital to housing at St. Vincent de Paul. That's for the veterans who come in the hospital and let us know, hey, I was homeless before coming and I don't want to go back to the streets. I need to medically get well. We'll put them at St. Vincent de Paul to respite while they seek housing. St. Vincent de Paul allows persons to come in, such as wound care, you know, PT, OT, and really work with them. Sorry, something just popped up on my screen. And then lastly, I'll just talk about one more very unique grant within Grant and Per Diem, and that's called the Transition in Place. PERC and Clearwater has a Transition in Place grant. What that means, they'll take veterans who go through transitional housing with them, but also want to become a lease tenant with them there in Clearwater. And if we determine they have the financial means to do that and they're interested, they can finish the grant and per diem and then take over that unit as a lease tenant, which is a nice segue into permanent housing. Next slide. These are all of our beds. There's 177 grant and per diem beds. So you heard me say 96 shelter beds, 177 grant per diem beds. That's a lot of beds. We're very blessed. That's a lot of beds in our catchment area. However, in FY22, we had over 1,100 homeless referrals. Now, mind you, we were able to divert some of those to family, to friends, even if that was out of state, or help them keep their housing. Sometimes these referrals come to us when they're at risk, but that's a lot of referrals to funnel through our beds. So sometimes it's not immediate. We call it emergency shelter, and we do work to get them in the next availability, but it's unfortunately due to availability, not always same day. Next slide. So just a little bit about the referral process for grant per diem. I described to you the different models of care. We have a team that staffs veterans and decides which models they'll be a best fit for, what's going to help them be most successful. For the 30-day that I talked about first, it's kind of like whatever's open, let's get them off the streets and then figure out the rest later. Next slide. These are the grant and per diem points of contact. Similar to what I said for the shelter point of contact, Lonnie Williams is the supervisor. So if ever you had someone who was interested in grant and per diem, he would be your first point of contact. Next slide. The last piece to our puzzle, or our homeless umbrella, is our HUD-VASH program. So HUD-VASH is a partnership between the VA and HUD. The VA provides case management and the housing authority provides a housing voucher. So these aren't just veterans who need the financial piece and a housing subsidy. These are veterans who really need case management to be able to sustain that housing subsidy. So the VA assigns case managers that go out and visit with these veterans anywhere between twice a week to weekly to monthly. It really is case by case depending on need. We help them at the forefront and finding the unit. And then once they're in the unit, we help them in that sustainment and sustaining that unit. So very often they kind of move through all these programs I just talked about. They may start in shelter, and when they get in, we're also referring them to HUD-VASH. So sometimes HUD-VASH is parallel, until they get housed. Lori's listed here as the HUD-VASH supervisor, and she's a good a good point of contact for HUD-VASH. Or again, if they're on the streets homeless, come to me and we'll link them with our programs and with Lori. Next slide. And that's it. Those are our main programs. Like I said, we heavily rely on community. We use Safe Harbor, we use Pinellas Hope. If we can't get them into us first, we use SSVF a lot. SSVF is a grantee, much like our contracts. A lot of people think VA has the financial assistance like 211. We don't. We lean on 211. We lean on SSVF for that deposit, for that financial assistance. But we do have the availability to get them somewhere and get them off the streets. So it's great. And like Trudy said, we'll have questions at the end. But again, here's my number. This is, again, the cell, but that's the best way to reach me. And again, thank you guys all for having me.
Thank you so much, Blossom. That was some really great information that you provided. That number 261 homeless veterans, I know we're working hard to reduce that with the initiatives at the Homeless Leadership Alliance, what you're doing there at the VA and various nonprofits in the community. So it's certainly a big goal to eliminate homelessness, and sharing these resources today is just extremely beneficial for everyone here in the group listening. So thank you for being here. And I'd like to move into our next presentation, which is going to be given to us today by Lynn Hales and Dr. Gregory Capriotti from Bay Pines VA Healthcare System. They are part of the Whole Health program and have a really interesting food insecurity solution for veterans in need. So Dr. Capriotti and Lynn, thank you so much for being here. If you would like to unmute and introduce yourself.
Yeah, hi everyone. My name is Dr. Greg Capriotti. I'm a psychologist and I'm the acting program manager here in Whole Health at Bay Pines VA Healthcare System. Before we get started, I'll turn it over to my counterpart, Lynn, if you want to introduce yourself.
Hi, my name is Lynn Hales. I'm a recreation therapist here at Bay Pines, working primarily in the mental health program areas, and I've been with the VA for almost 14 years now.
All right, you can go ahead and go to the next slide, Trudy. So we're going to break this presentation up today into two parts. So my job today is going to be telling you a little bit about the problem itself, food insecurity, and how that relates to exactly what Blossom was talking about moments ago. And then I'm going to turn it over to Lynn to talk to you about the collaboration that we have through some grant funding with Feeding Tampa Bay Pinellas chapter to start to meet some of these food insecurity needs in the veteran population. So first and foremost here, let's define what actually is food insecurity. So this is lack of consistent access to enough food for every person in the household to live an active, healthy life. And as time goes on here in this presentation, we're gonna talk about the difference between food and healthy food. You know, food that's actually going to be able to drive people's health outcomes. You know, food is one of the biggest contributors to our health outcomes, as we're going to talk about a little bit later. And that's really the focus of the program that we have in collaboration with Feeding Tampa Bay. So what is it about food insecurity? What are some of the causes of food insecurity? Well, it's multifactorial, and it boils down to a lot of different social determinants of health. So there's a large, obviously, a socioeconomic aspect to it. With lower socioeconomic status, determines where people live, and may live in parts of town where there isn't as good of access to healthy food. Sometimes these are described as food deserts, and there's specific criteria for that. And there's a lot of factors that play into that. There's systemic issues that can kind of contribute to where people live and their low socioeconomic status. But low SES is really the major driving factor. And going back to what Blossom was talking about earlier, you can imagine how if somebody is housing insecure, you can imagine if they don't have that basic need met, that food isn't too far removed from that. So if you go to the next slide, Trudy.
little bit of a delay here. I'm not sure how
That's
we're
okay.
done here.
No problem.
Hmm.
Okay, so as I mentioned before, so food is just more, it's more than just calories, more than just enough calories to kind of sustain our day-to-day activities. So there are estimates out there that 80% of preventable chronic illness, things like diabetes and high blood pressure, can really all be traced back to something diet related. So food is a big driver of health outcomes. So if you look globally at what is called the standard American diet, in parentheses, you'll notice it's called the SAD diet. Estimates are that 60% of our diet is composed of this type of food called ultra processed foods. Ultra processed foods are foods that are where there's a lot of additives, there's artificial flavorings, things like food coloring, stabilizers, preservatives. These are things that are really processed in a factory to a large degree. They don't look anything like their original form in a lot of ways. So 60% of our diet is now ultra processed foods. So ultra processed food consumption is associated with an increased risk of a lot of the health problems that we're seeing, some of these preventable illnesses that I mentioned before. And really what this boils down to, the big takeaway message from this is that there's food insecurity is highly associated with intake of these ultra processed foods, because ultra processed foods typically use cheaper ingredients and they're just more affordable. So obviously if you're struggling with low socioeconomic status, you don't have a lot of income, you may be forced to seek out ultra processed foods because that's all that you're able to afford. So the link here is food insecurity puts people in a position to consume even more of these ultra processed foods, which are driving a lot of the health problems that we see every day. Next slide, please, Trudy. So how does this factor into the veteran population? So this isn't just our community, this is just veteran population as a whole. So this is some data from the US Department of Agriculture. So looking at some aggregate data from 2005 to 2019. So 11.1% of working age veterans experience food insecurity. That's a pretty high percentage. Veterans compared to the general population have a 7.4% increased risk for food insecurity. And they even broke this down into some subpopulations within the veteran community. So pre-9/11, 1990 through August of 2001, a pretty significant rate of food insecurity. And also this period of May 1975 through July 1990. So these are some, and this study that I'm referencing here was published in 2021. So these are very recent numbers that we're looking at here. If you go to the next slide, Trudy. And now what I'm going to do is I'm going to turn it over. So now my job was to really identify the problem, right? So this is the problem that we're seeing both globally and also in the veteran population. So what I'm going to do now is I'm going to turn it over to Lynn to talk about this Food RX program that we've been working on in collaboration with Feeding Tampa Bay. So Lynn, go ahead, take it away.
Awesome, I appreciate it. So Bay Pines had a unique opportunity to collaborate with Feeding Tampa Bay. In early 2021, Feeding Tampa Bay was awarded a $100,000 grant by an anonymous donor, and it wanted to target specifically the veteran population and providing healthy food options for them. So with the collaboration of the two organizations, we identified what the criteria would be for veterans to be referred to this program. And we actually initiated those services in May of 2021, and they ran through March of 2022 this year. And so the criteria for involvement was that, and this was all filtered through social work in their initial assessments and evaluations with veterans, was to first identify the needs. So some of the questions that were asked were, within the last 12 months, has the veteran ever run out of money where they weren't able to buy enough food, or did their food that they did purchase just not last them? And if they answered yes to either of those questions and it was an immediate need, then they kind of were then referred to the next phase of the program, which had them complete a pre and post survey. And I'll talk about some of the questions that were on that survey initially to track the outcomes of it. And then they participated in a HEAL education class. So that was like a healthy eating and living class. That class, the emphasis of it was in collaboration with Dr. Capriati, psychology, and also one of our dietitians, to cover the impact that diet has on not only mental health, but physical health, general guidelines. What are the suggestions? What's a balanced diet look like? How do you read food labels? What things to look for, what things to avoid, especially for a lot of the veterans being referred had chronic health conditions. So specific to your diabetes or your heart disease, what are the things that you want to look for and what are the things that you want to avoid? Another thing that was covered during that HEAL class was storing food and preparing food, which we found a lot of the veterans had, questions on and needed that input of what are the best ways to prepare my vegetables, my meats, to get the most nutritional benefit from them. Next slide. So once they completed the surveys, they attended the HEAL class. Part of the program was that the veterans received 12 vouchers. Those were guaranteed, and then based on funding and need through the grant, additional vouchers were provided as needed. So some veterans, they got 12 and then they were able to transition and or had the funds to phase out of the program. Others needed additional support, and so we did have additional vouchers that were provided to them. So these vouchers were redeemable we had a Feeding Tampa Bay food truck that comes to Bay Pines once a week. It's a refrigerated air truck, and it provided prepackaged meals. So the veteran could take the voucher either here on campus at Bay Pines and redeem it, or they could take it to any location that was closer. So some of the veterans we saw were housed in northern parts of the county, Clearwater, Dunedin, Tarpon Springs even. And so it was a long drive for them to get here. And so they would be able to use those vouchers at Clearwater locations, anything that was the most convenient for them. The voucher was good for 1 box of prepackaged dry goods. So things like rice, oats, cereal, shelf-stable milk, and 1 box of fresh produce and fruits that were received from local farms within the community. What we found as veterans were referred into the program was that transportation was one of the biggest barriers that they had and impacted them being able to get the food. So whether it was them getting here to Bay Pines or getting to one of the other locations, they just didn't have the means or the transportation or the physical ability to navigate buses or anything like that to get here. So with that being identified, a portion of the grant funds were then used to provide taxi cabs for the veteran to get here to Bay Pines. So in addition to not only are you getting the voucher for food, we did provide a transportation round trip for them here and back. Next slide. So this graph here shows over the course of the program, so you'll see 10 months here, we served a total of 238 veterans were referred to the Feeding Tampa Bay program in 10 months. We served just under 1,100 boxes of food. You can see by the graph, there's quite an uptick in both referrals and redemptions of the boxes right around the holidays. We saw a big uptick there. And a total of 379 round trip taxi fares were provided and did take quite a chunk of the funding being the biggest hurdle for them. Next slide. As I mentioned in the beginning, the veterans were asked to do a pre and post survey. So what our goals were for that survey were to really look at where they were starting and where they ended after involvement in this 12 weeks and or more if they stayed longer. And it asked the veteran to rate their overall well-being. So their overall health, their physical health, and their rating of quality of life, and also their self-efficacy in areas such as understanding how diet impacts their health, their ability to get to grocery stores, to get the access within the community and to prepare foods, and also asking for help when needed. So if they didn't have transportation, how comfortable were they going to a family member, a friend, asking for that assistance, or a VA provider saying, look, I need help and this is what my needs are. The questions were all rated on a 1 to 5 scale. As you can see below, always, often, sometimes, rarely, and never. And I just pulled the top 5 areas that we saw the most improvement in. So the biggest improvement that we saw was asking for help and being able to get access to food when it was needed. A lot of veterans, just through conversation, it was just such a relief that they had, and it was like such a burden that had been on their plate for so long, and a sense of that somebody really cares, because it's not a program that they anticipated getting. So when they shared with a social worker or with a nurse that, you know, they were having trouble getting food, or they just didn't have enough to last them and their family, being able to say, here's an immediate resolve was such a relief for them. The next highest one that we saw was the access to frequent and healthy meals. So as I mentioned, these vouchers and the truck comes to Bay Pines once a week. So it was guaranteed that if they needed it once a week, they could get that for 12 weeks. Next one was the confidence in preparing healthy foods and meals. Part of this as well, like in conversation with the veterans and through that class, was that if veterans expressed the need for additional education on how to prepare these meals, they did get a referral to Food and Nutrition Service, where they were able to get one-to-one support and assistance in preparing food and things specific to their diet needs and health conditions. So it was a nice expansion of services and a referral process. And then you'll see the last 2 were the rating of overall health, and then the ability to consume enough food to maintain their weight. In addition, so as I mentioned, this program had specific criteria for veterans to be referred to it, but we just received additional grant funding through Feeding Tampa Bay that will expand the program even more, reaching a greater population throughout Pinellas. And so we're currently working on the criteria for that, but it'll be actively, collaborating with social work and our food and nutrition programs to assure that we're not only providing the resources needed, but also transitioning how to get those within the community after your involvement in this program. And then also with food and nutrition, how to prepare those foods so that, yes, we're giving them to you, but now you have the skills to prepare the meals and feel more confident in doing so moving forward. Oh, and then there's one other resource that, if needed on urgent, that they do not have to meet criteria for, that is available, is a food pantry here at Bay Pines that is available at voluntary service. So that is just no specific guidelines needed to get access to that food. They just show up and say they need it, and that can be provided during business hours. And I think that is all.
Wonderful. Thank you so much, Lynn and Dr. Capriotti, for providing that information. I think, I've been a nurse for many years, and I think that's something that oftentimes people don't think of when they go to the doctor's office, is sharing their struggles with accessibility to good nutrition and enough nutrition, so that is becoming a resource to the veterans at Bay Pines is huge. And that confidence in asking, that was, I think that was a testament to the program and the work that the social workers do to build that trust, to allow the veteran to feel comfortable in asking for support. Obviously, here at Empath Health, we provide a lot of healthcare services and programs and support for the community as a community provider outside of the VA. Obviously, one of our biggest programs is Suncoast Hospice and our palliative care program, where we're supporting people with chronic and terminal illness. And I think all of our presenters today have really highlighted just the oftentimes vicious cycle of, lack of stable housing, lack of access to nutritious or healthy food options, can just really contribute and exacerbate existing conditions or create new chronic and terminal illnesses. So I just wanted to share that here at Empath Health, we do work with homeless people. I actually had the pleasure of standing in the rain at the homeless stand down at Bay Pines this year, and was fortunate enough to meet a veteran who was the caregiver for his wife, and she was struggling with a terminal illness, and we were able to get hospice care for her and support him as the caregiver, even though they were part of the St. Vincent de Paul homeless hotel program. So certainly want to share that with the listeners today, that regardless of ability to pay, Suncoast Hospice wants to support the community. And another way that we support the community, as you can see here on the screen, is every year, this will be our 3rd year, we do host a holiday food drive for veterans. Lynn shared that uptick in the need for food resources around the holidays. So this is a way that the community can give back to our veterans. Any food donations are delivered down to the Bay Pines Food Pantry to help supplement the supplies that they have, so that as these veterans in need come on campus and express a need for food, that we can help contribute some items to the pantry over that holiday period. So we're conducting that drive between November 7th and December 16 at our 3 service center locations on Tampa Road, Roosevelt Boulevard, and First Avenue South. My information is kind of tiny on the flyer. I'll pop it in the chat. I know that Richard had asked for my contact information. I'll post my phone and email. If you do need those specific addresses, please let me know. But we'd love to encourage the community to make a donation to veterans in need over the holidays with food. Let's jump to the next slide. I think this is a resource that I recently learned about out in the community. Again, it's an offshoot of Feeding Tampa Bay. Over there on 54th Avenue North, inside of Northwest Church, is the Feeding Pinellas Empowerment Center. What I love about this community resource is not only do they provide a 3-course hot meal every evening, Monday through Friday, they do have a food pantry on site, as well as showers, laundry, a clothing closet, ESOL adult education courses, job training opportunities, benefits assistance, nutritional education, and referrals to additional resources. So that is a great community resource there for folks that may not have accessibility to some of the VA resources. Next slide. You heard Blossom referencing the Homeless Leadership Alliance. They do have a veterans task force, and I have the pleasure of working on the PIT volunteer committee. So the PIT is the point in time count. Actually, Atul, if you want to jump to the next slide, I thought that's where I was at. So the point in time count is going to be January 26th of 2023. The PIT count is a really important tool. It provides a snapshot of Pinellas County residents experiencing homelessness, and the information is it provides understanding to the needs of the community and adequately informs policy at various levels. So if anyone's interested in participating as a volunteer for the PIT count, you can sign up using the link on the screen or take a photo of the QR code there. But the HLA is looking for volunteers for that important PIT count in January of 23. And let's jump back a slide, Atul, to this one, another QR code. This is a phenomenal resource guide that HLA has put together. It provides a variety of different resources, from homeless resources, veteran-centric resources, shelters, food pantries, legal. So again, it's a QR code. You can snap the picture or go to that link there if you want to learn more information. And with that, let's jump into some of these questions that we have here. I see Blossom, you wanted to put a resource into the chat.
Yes, I didn't mention our national call center.
Okay.
So I just popped the number in the chat. Any veteran can call that. It's a 24-hour line, and they will direct persons to us locally at Bay Pines. Our outreach workers will call those veterans back with homeless resource needs.
Great.
We also had a question earlier from Maria about information about help for veteran widows.
We get a lot of calls. I don't know about a lot, but a fair amount of calls from widows to homeless programs. Unfortunately, the shelter programs, grant and per diems, and the HUD-VASH program that I talked about cannot assist widows. So when we get those calls, we lean on the community. I do also always encourage a widow to go to our other side of the house, the VBA. That's our business side of the house, the one that helps with benefits. Because sometimes if a veteran was getting service connections, there's some monetary help that they can get, but as far as getting in homeless programs, they cannot. Now, if they're in a HUD-VASH apartment already and the veteran passes, I'm pretty sure that they keep that voucher. But if they're not in already, it does become a little more difficult, sadly, to assist widows.
There is a pension available to surviving spouses if the veteran met certain criteria, and one of those is at least 1 day of war service. It's called aid in attendance. So I would strongly encourage in that situation with a surviving spouse to reach out to a veteran service organization such as Florida Department of Veterans Affairs or Pinellas County Veteran Services. Those VSOs are trained and know those forms inside out. They know exactly how to triage each situation to qualify either the veteran themselves or surviving spouse to see if they can qualify for some kind of monetary assistance. So having worked in the assisted living world for several years, that was typically one of my first questions when we had an inquiry for a move-in. Did you serve in the military? So that we could see if we could match the veteran or the spouse to the aid and attendance benefit. So that is a potential form of assistance there for a surviving spouse.
Yes. And the DAV, the FTVA, they're all the VSOs. You're right, Trudy. They're great. That's what they do. That's their expertise. So they're great to lean on. I'll put in the chat also the direct line to the benefits offices. And some of the VSOs are there in that building, but they're elsewhere too. I mean, Pinellas County has VSOs, so there's many ways to access.
I actually had a quick question. If there's no more questions from the viewers, and Blossom, you may be able to best answer this one. The homeless veteran program through Bay Pines, the veteran in question would have to be receiving healthcare services through the healthcare system?
No, I'm glad you brought that up because I didn't mention that. So to go into our 30-day contract shelters, that's the group I talked about first. You do have to be eligible for healthcare. To go into the transitional housing, that's the grant and per diem 3 to 6 month program. And to go into SSVF, which is the hotels I heard someone mention, or the assistance for deposits. You only had to have served 1 day of active duty outside of training and have anything other than a dishonorable discharge. We are also starting to look at veterans that fall in that category for the HUD-VASH program. So that was that HUD-VA partnership. It's a little more strict criteria than grant and per diem and SSVF. But there are some persons who do not receive healthcare that we're starting to take into HUD-VASH too, once we can determine a little bit more about their eligibility.
Okay, great. I always, when I'm meeting veterans and spouses in the community at the coffee groups and such, and I referenced this with the panelists before we went live, was encouraging folks that may have explored eligibility with the VA healthcare system or benefits in the past and maybe being told no for whatever reason. It's always a really great idea to revisit eligibility because your personal situation may have changed, legislation with presumptive conditions or areas of service may have changed. So what may have been a no in the past, now based on a new set of circumstances and situation, may be a yes. So for folks to be now eligible for healthcare and accessing, the Food RX program and all these other great resources is just something that I would strongly encourage our viewers today, that when you meet these veterans and ask them if they're using the VA and it's a no for whatever reason, just encouraging them to reach out, just to revisit that.
And a lot of veterans, I would say, especially our elderly population, sometimes that Vietnam era, they feel like, well, if I wasn't boots on the ground or I didn't have some type of service related injury, I'm not eligible. But many of them are. So like Trudy said, encourage them to come check their eligibility. There's this misperception. I don't think they were educated as well back then when they exited the military, that this is what you are eligible for and this is what you're not eligible for. And they think they aren't. And here all these years they have been eligible.
Yeah, absolutely. Wade or Lynn or Dr. Capriotti, any final thoughts or comments? I don't know, Wade, if you had some specific resources for that spouse question, if you see that a lot too with 211.
Can you hear me?
Yes.
Okay. Yeah. So as far as the spouse support, we do get from time to time some spouses of veterans who have passed away or things like that. And generally what we do is try to connect them to the VA, but if not, we still try to assist them if they need some type of financial services. So we do have our internal financial services that we can help them with one time a year. So we do definitely try to put them at the forefront as far as that.
Great. Thank you so much.
And I'll just add, in terms of Feeding Tampa Bay Food RX program, one of the things that we have recently started to ask veterans whenever they, enroll in the program, whenever they're picking up their food, how many people in their household are also benefiting from the food. So, the veteran, of course, is our primary client, but we're also very aware that this is impacting other people in the household as well. And this is actually data that we're trying to collect even more of over the upcoming year.
Great.
And just to piggyback on that as well, if you do have a veteran that is in need, the first round of referral would be just to go directly to social work, and social work will work with me directly to get them assigned an ID number and vouchers, and we can follow up from that point. But social work would be that first level of referral for the program.
Great. Well, this has been some amazing information today. I hope that the viewers have learned some helpful tips of how to support veterans out in the community that you come across. I did see a lot of former service member status in the chat. So I want to say to everyone on the call today, thank you so much for your service. To our panelists, thank you so much for sharing what it is that you do. Your passion for serving veterans is obvious, and we really appreciate you being a part of our panel today and providing this important information. Certainly, if you do have any follow-up questions, feel free to reach out to me. I can further explain our Empath Health programs and help navigate to some of these wonderful VA and other community providers if you need some follow-up assistance. So with that, we'll close out for today. November and December, just the falling of the fourth Wednesday of the month is kind of adjacent to the holidays. So we will be taking a break November through December, coming back with these live briefings starting January 2023. But in lieu of the briefings, please do feel free to make a food donation to benefit the Bay Pines Food Pantry, and we would appreciate your assistance with that. So thank you so much, everybody, and I hope you have a great rest of the day.
Thanks, everyone.
Thank you.
Thank you.